what the hell does this Sun Guan and Sure mean? What do they relate to? Why should I bother with them? But when you get to the end of that thenar eminence, even I can feel it on this little plastic man, there's a little, I can't feel his pulse. Hi, welcome to Secrets of the Pulse Diagnosis Revealed. These are the secret things that the Masters of the Pulse will not tell you. I'm going to reveal them in this video, so make sure you stay tuned. When I was first in China, back in the day, that was me with my teacher, Mr. Miao. It's not really my teacher. That was like a random guy that I found in the I think he was in the Hangzhou train station. So if you've just tuned on to this video, this is part 2 of the Secrets of the Pulse Diagnosis Revealed. And I'm making this video to answer a subscriber's question. So if you haven't seen part 1, make sure you jump onto part 1. I've got a couple of books here about pulse diagnosis that you may have come across. So this is a common one, the Bob Flaw's The Secrets of the Pulse. There's also some pulse diagnosis in this Web That Has No Weaver, and there's pulse diagnosis in a lot of books. This is a really good book I used to use a lot when I was first learning it. It talks about different types of styles of pulse diagnosis. It's a book that I got in Shanghai from the People's Republic of China bookstore, the Foreign Languages bookstore. It's called Pulse Diagnosis, written by Lu Yubin, Shandong Science and Technology Press. I actually think this is one of the better books because it just seemed to make sense to me in terms of, and for the price, if you can get hold of that, it's pretty cheap. This is a more expensive book. I think it's like, $94 Australian dollars. And this, honestly, it was one of those books where I just really didn't get much out of it, even though I purchased it. It just looks good on my shelf. I'm sure it's great if you actually read it, but I never really got any information out of it that I could kind of, I don't know, put into practice. And I think one thing that's important to kind of understand in pulse is the way that you learn. Like, I'm a doing learner, right? Kinesthetic learner. So I enjoy failing. I enjoy giving it a try and getting in there and trying and learning like that. I don't learn that well from just from reading books. Like, you can't just not read any books. You just be a nutter, especially in Chinese medicine. So I learn better by that interactive activity of doing it. And so maybe that's also why some people are better at pulse than others, because they actually enjoy doing it versus reading it. And it's not something you can learn by just reading it, but it's also not something you can learn by just doing it. So what we're going to do is we're going to use this little model. This is a little Halloween prop that I got. I'm going to take off this weird little bandage off him because it's just got the little bit of the wrist here at the side. This old bloody hand. And I'm going to show you how you would sort of do the pulse diagnosis on this a little bit, and I'll show you I'll have some pictures on this as well. So this guy's question was, how do you check the pulse? Like, where do you put your fingers? So at the end of the wrist, so this is the thenar eminence, this kind of area here, right? So you can see on my hand, you've got this chunky bit, and that's your lung channel. So your pulse, the first position is actually lung 9. Like, it is that exact acupuncture point. So if you're a Chinese medicine student, that shouldn't be hard for you. And I think this guy said he's a medical student, like a Western medical student. So you might need to look up how to find lung 9 because most students kind of know that. But when you get to the end of that thenar eminence, even I can feel it on this little plastic man, there's a little, I can't feel his pulse. I can feel that little divot that kind of comes down there. And your finger just kind of fits in that spot. And so what you do is you have 1, 2, and 3 fingers down, right, like that. So I'm going to put that close to the thing so you can kind of see that. So you have that's the end of that thing. So you have 1, 2, and 3, right? Now, this hand is kind of the same size as my hand. And this is another thing that people can get really caught up on. And this is another reason why, this guy's question was like, well, why can't I find any information about how to feel the pulse? Well, because these different systems do have differences. Like, some teachers will teach you to space your fingers out if the person's bigger than you. And some teachers will teach you not to do that. I would suggest when you're first checking the pulse, if that you just put your fingers 1, 2, 3 touching. Now certainly don't bunch them up into a bunch, but just have them, I'll put a photo over the top here so you can kind of see. And just have them in that position. Now which part of your fingers should you be feeling the pulse with? It should be the end of the fingers, like the tips of the fingers, right? If there's something wrong with your finger, like I had a student recently in one of my classes that had like eczema or some kind of dermatitis on one of her fingers, and she couldn't feel with that finger at all, or you've got like desensitization in one of your fingers. Now that's a really big problem. If you're going to be a master of the pulse, you're going to be a Chinese medicine practitioner, you kind of need your fingers. You need to look after your fingers, and you need them because they're like your eyes of how you're going to be getting that diagnosis. Like something that I struggle with is I'm a musician and I play guitar, is that I get calluses on my fingers. Now it's not such a big deal. They're not like all scratchy unless if I stop playing for a while, then they'll kind of, the calluses peel off, and then you've got these like little peeling bits on your fingers, which isn't great. But the end of your fingers gets thicker, so that the actual pad of your finger is where you should feel the pulse. Now on this hand, my right hand, which is the guitar, the pressing hand, then I will usually feel the pulse, not with the tip, just below that. And so I just kind of have my hand kind of, so on this guy here, if that was those fingers, normally it'd be like this, have it sort of like that. That'd be the proper way. So the guy was asking, where do you put your finger? You put it just behind there. So this is not, actually it would be this hand would be this side, because you wouldn't see this pinky on there. So it's always the side. So this, and then when you do this hand, it'd be the other hand. We don't have another hand. So you should have your thumb behind, basically just resting. Have the hand kind of on the table or on something. And again, we're going to talk about why there's different ways, but like this should be on the lung 9. And then just after that, and then just after that, so in a line. Now, once you put that first 2 or 3 fingers on, you're in the right position, then you can kind of start to feel, and you should feel a pulsing underneath these fingers, right? If I had very fat fingers, let's say, like I was a much bigger person, then I may have to bunch my fingers up a little bit. Same as when you're feeling a pulse on a kid. Or if I was like I was feeling a person who's much bigger than me, I might space my fingers out a little bit. But when you first do it, it's better not to do that. And no matter what the size of the person, that first pulse is always that lung 9. It's always that position. Each side of the pulse is going to feel quite different. And this would be something that will be really surprising to you if you're a Western medicine student. We only have one heart. We're not Doctor Who. But there's a big difference in the pulse on each side. And so that's one of the aspects of pulse. Now, to actually give you a proper tutorial on how to feel the pulse, you'd probably need like 3 or 4 videos. It's not going to fit into sort of even a 1 hour video. But I'll kind of do my best to give you a guidance of what to do. So that's the first thing, right? Is have the fingers like that. Now, how do you position the patient's hand? What do you do? Where do you put it? There's 2 common ways that are used. I'm just going to use this. I've got the little man's hand. And so this side would be like this for me. So if this was the patient's hand and I've got my fingers like that, they would kind of be in this position here. I'll get rid of this piece of material. This is the position that I use. So you have the patient's hand like this. And this is because my system uses this position, right? So there's 2 ways to have the pulse. So the pulse is coming along this area here. There are people that make the patient's hand sit like this, and then they'll come and feel the pulse even like this. I've seen some people do that. I wouldn't recommend that style, because what you want to do is this finger should always feel the sun, this finger should always feel the guan, and this finger should always feel the chi, right? So these are your 3 pulse fingers. You're basically training this finger to always do the same thing. Now, let's say this is my sun, guan, and chi finger, right? And so I'm used to that. If this is my patient, Sun, Guan, and Shi's on there, which is the first 1, 2, and 3 positions, right? We'll go through what they are later on. Like I said, this is kind of like a whole year of Chinese medicine school, I guess, in one video. It might be 2 videos. But anyway, so the first, the Sun, Guan, and the Shi on those positions. If I then put my fingers like this, I'm using my Sun finger, let's say, to feel the Chi, which is the end one, the last one. And so it just kind of, apart from the fact that my hand's in a different position, even if my hand was like this, like I've seen some practitioners do this. And I don't want to try to be mean to those other practitioners or rude to them, or like, I guess I try to be inclusive on this channel because there are lots of people that do things for reasons. And sometimes that reason could just be because that's the way you've always done it. But if that reason's for a purpose, then, and I guess that's why sometimes people don't make these videos, because I don't want you to walk away thinking, oh, my practitioner always feels my pulse like this, they're doing it wrong. They are probably doing it to the best of their ability that they know, right? And so none of these, I guess I feel like I want to talk into the camera a little bit. So, like, I want to talk into the camera, but you can't see me. So, like, none of these ways are wrong. They're just different. So, I'm going to show you this way here. There's 2 ways that I was taught how to do it. The first way was have the patient's hand like this, and then use a little cushion. So, you have the good old pulse cushion. Now, if you don't have a pulse cushion, you can just use a rolled up towel or something like that. So I would often use a towel and place the patient's wrist on the towel. And then it's hard to explain this, but let's say the hand would, this is really, really hard, but, oh, this guy can be the pulse feeling hand. So the hand would kind of come like this, right? And feel the pulse. Like, let's say I'm the patient and he's the practitioner, this little creepy thing. Then I would put my hands, some practitioners use quite a puffed up thing, like a cushion that's kind of like that. And they'll say, put your hand on that cushion, right? Now you can probably see my hand is relaxed on the cushion, right? The cushion kind of cushions your wrist. But what can happen with the cushion is people's hands extend. And you're basically extending this artery. And that's what you're feeling, right? The pulse is, you're feeling this portion here of this artery. I'm trying to get to the right position here. So let's say this is the practitioner. Actually, his hand would have to be this one. So some people they make the patient extend the wrist like all the way out like this. And so then the practitioner's kind of feeling it like this. So if the patient's hand's like that and there's no cushion underneath it, and those 3 fingers, so it would be like this, right? To stop make the patient's hand be relaxed. Now, with a bigger cushion, I mean, maybe it's just because I'm so used to having the hand in this position, I just naturally kind of rotate my hand a little bit like that way. You know, like sort of supinate it a little bit more than have it. Like, you certainly don't want the hand pronated all the way out like this. Because what happens is when you're pronating it, you can feel it on yourself. You feel this is all stretched and this is all tight. So not only is the artery kind of possibly stretched out, and certainly, like, it's not as exaggerated as that, but I see some people put the hands like that. And it's all stretched out here. It's very uncomfortable for my shoulder, actually. So you want the person in the most natural position. Now, some practitioners will just say, stick your hands out, and then, you know, off you go there, pressing on it. No matter how, like, patient sometimes here, patient sometimes there, whatever. I will most of the time make the patients put their hand on, like, just bend their elbow so that I'm comfortable, because you have to sit there and do it for a minute each side. Sometimes longer, especially if you're first learning it, you might be doing it a bit longer. So by bending the patient's elbow like this, then if I'm sort of sitting face to face with them and I'm this creepy hand man, then I can kind of come along like this and do it like that. Just gonna cover over his bloody there, it doesn't look so great. And so that's the position I was taught to kind of do it in. Now, when you're doing your own pulse, if you're practicing on yourself, I'm going to come right up here. So you put your first finger on the sun, the guan, and the chur position like that. So 1, 2, 3, like that. So like that, 1, 2, 3. And what you want to do is see how I've got my thumb resting on my own hand. So your hand kind of almost like cradles your hand, like this hand, the feeling hand, does that. And the same as when you do this side. So I hope you can just make them come out a little bit. So I hope you can kind of see that. So this, what I'm showing you is your thumb kind of cradles the hand, like provide something for your hand, your wrist to rest on. This is just when you're doing your own pulse. 1, 2, 3. And most practitioners will then do it close to their heart, like they'll move their hand, they'll after they've got that position, they'll move it closer to their heart. I'll show you that in a sec. So after you've held it like that, and then what you want to do is have it up here. So you can see that my thumb is kind of resting there, and you don't want your hand above your heart. So you don't want your hand you don't want to hold your hand above your heart. You kind of either want it at the same position, but so that I see a lot of practitioners do it like this, like you're at the same level as your heart, or like I think your heart's kind of exactly there. So, you know, you don't want it, you just want to be relaxed, but you don't want to have your own hand stretching out. That's the point. Like, so I'm showing you all those positions so that like the patient should be relaxed. Now, if you're checking your own pulse, you're the patient, right? So you're both your checking hand, the hand you're feeling with, you should be relaxed as the person checking it, so that you aren't thinking about other things. We'll kind of go through that in a minute. But the other part of it is if the patient's hands are kind of like stretched or clenched or doing fidgeting or something like that, then that's all part of it. Don't have them doing that. So you can kind of use the thumb of your hand to hold like that. So if you're just kind of learning how to do it, you're often checking your own pulse a lot to kind of learn. But you need to make sure that you're always training this finger to be the sun, right? The first fingers is the sun. So this sun, this first finger always checks this sun, and this first finger always checks this sun. So they're kind of, you're never using this finger to check the guans or the churs or anything like that, unless you've got a baby or a tiny person or something like that, and you have to move that one finger into those positions. Like, you know, sometimes that one finger might even check all 3 pulses in a baby, right? An infant. But that's not what we're talking about today. We're trying to just keep it simple for you. And so that's what you would be doing. You'd have your hands like that. And so I would just rest my elbows on the desk. That's perfect. But I don't know if you don't have that, certainly don't have your hand when you're checking your own pulse kind of stretching out like this. Let's say you're standing like this and you're like, oh, I'm just going to stretch out. Like, and you're supinating your hands. Like, try not to be supinating your hands. That's the supination, that movement, right? Pronation is this. And that's where, like, it's naturally more comfortable to be pronated with your wrist. And not where your wrist doesn't pronate, your arm, your forearm. And that's more comfortable, right? To kind of be like that. And so you can kind of do it, you kind of do your own pulse like that. So that's the first bit, the patient's position, your position. Now, the first thing you want to make sure is that you are very comfortable. Now, no matter whether you're using a cushion under the hand, under the wrist, you can't check your own pulse using a cushion under the wrist. It's like impossible, because how are you going to do it? Like, you'll end up doing this, what I said before. And I think that is, like, I don't like saying, oh, that's wrong, but I want to say that's not the greatest way to do it. So I'm sorry if your practitioner does it like that. But for people on this channel who want to learn how to do things properly or as well as you can, it makes sense to do things the same way. Because what you're trying to do essentially is make your body and your mind a machine that just focuses on that one thing. So you need to get rid of all the distractions that you might have. So this is the second part of taking the pulse. It's like mindfulness, or we were never taught that in school, like mindfulness, because when I was studying in 1997, no one ever knew what mindfulness was. So mindfulness, or just training your mind to get rid of the distractions. So you could do a little mindfulness exercise before you start. Now, it doesn't have to be like a big long thing. It could just be like the one I put on this channel ages ago, which was like, just look at 3 things. Think of 3 things you can smell in the room, 3 things you can see, 3 things you can feel, something like that. That's a good one just to bring your attention to the present moment. Don't have the patient talking while you're checking the pulse if you can help it. If they're a talkative person, or you're a talkative person, I find this myself, I'm a talkative person and I often ask patients questions. I'm not saying you can never talk while you're checking the pulse. Like sometimes I'll talk because I felt something in the pulse and I want to know what that means. So it could be like one or two of two things, and that's often why practitioners will ask a patient a question. But you certainly don't want to ask patients questions like if you're a practitioner or a student practitioner watching this, then what if you have to write something down while you're asking the question? Now I make this mistake all the time because I'm just a talkative person, and I have to stop myself from talking unnecessarily, right? Unless it's really important to kind of feel what's that feeling. So let's say you feel like a wiry pulse in a particular position, a good example would be a superficial sun position, right? So that, if you don't know what that means, that's fine. I don't expect you to know what that means, but you feel something, you feel a certain quality. And that could mean either the person's got, if it's on the left side, it could be like a cold or a flu coming on, or it could be something to do with their heart. And when we say these words, it means their heart in Chinese medicine, not like they've got a heart condition. Not like, you have an atrial fibrillation or some kind of actual heart problem. It means like the heart in Chinese medicine relates to your sleep. It relates to your mental emotional functions, something like that. So you might just ask them that question, not the mental emotional functions, but have you been getting a cold or a flu lately? That's just like a kind of a one word, well, it should be a one word answer. Some patients don't answer with a one word, but what I'm getting at is don't talk to the patient while you're checking their pulse if you can help it, right? Try not to. Make sure the patient's legs are uncrossed, and that's where these books, where are those books gone? That's where these kind of books are kind of helpful to kind of, probably this one's a bit more helpful with that, like what should you be doing, the positionings and all that kind of stuff. So make sure you're comfortable and the patient is comfortable, number one, right? And so you've got a desk to check it on. You can't check the patient's pulse holding it up in the air. See people trying to do this. It's really we're not checking the pulse for an emergency situation, right? You're not sort of going, I don't have time to put them in a comfortable position, so I'm going to just check that they're alive. That's not why you're checking it. So if you're not comfortable and relaxed, and they're not comfortable and relaxed, it's not going to be a true reading. It's not going to be an accurate reading. And you should always have the patient in the same position. Now, some styles of acupuncture always check the pulse lying down when the patient's lying down. Some styles check it while they're sitting up. Most herbal medicine styles check it when they're sitting up. And probably that tradition has started because if you're a herbalist, you wouldn't even have a lying down thing, a couch for them to lie down on, right? You wouldn't have a treatment table because you're not doing the treatment on them probably. Like some herbalists might check their abdomen and have them lying down, but let's say in the history of Chinese medicine, if you're a herbalist, you didn't do acupuncture, you were just a herbalist. So that's why a lot of herbal lineages check the pulse sitting up, and I'm guessing a lot of acupuncture lineages check it lying down because the patient was often lying down, and that's how it probably started. I could be wrong, but that makes sense to me. So often this is what you'll do what your teacher's done. And I know some practitioners that are herbalists and acupuncturists that do specific styles for each one. So they might check the pulse lying down because, again, the meaning of the pulse could be different for herbs and different for acupuncture. And you might say, Marie, but they've only got one heart and it's only one pulse. But why you're feeling that pulse with acupuncture, often you can feel the pulse during the treatment or as part of the treatment, whether the pulse is changing. That's a big part of certain styles of acupuncture, a big part of Japanese style of acupuncture, like classical acupuncture, that's a big part of it. It's kind of, unfortunately, a bit of a lost part of TCM, like the stock standard traditional Chinese medicine. It's not as commonly used, right? So where you're checking the pulse, the position, as in the patient's position, are they lying down or sitting up, the position that their hands are in. So if they're lying down, most of the time their hands will be on the side. You're not going to stretch the hands out like this to check the pulse most often, right? Again, it just makes sense, to have the hands on the side, not supinated, more pronated, not pronated down, but just in that natural position. what else do we need to know about pulse? There's so much more. So you've kind of got the idea of, okay, we've got the positions that we're going to do, the Sun, Guan, and Shou. Now let's talk about what those things mean very roughly, and what you're trying to feel. So this is where you could get the information from the textbooks. What are you trying to feel? And what does that feeling mean? Is most often you can get that from books, or from, like, maybe it's part of your system of Chinese medicine, what it means as well, which should be rooted in the textbooks too. Like, it's not just some kind of like woo weird thing. Look, there are different styles of Chinese medicine where people infer different levels of information from pulse. Now, I know a style of pulse diagnosis that they check the pulse for a very long time. Like, when I was first in China, back in the day, back in 2000. Where's my little photo? I found this recently. That was me. Well, with my teacher, Mr. Miyaki. No, that's not really my teacher. That was like a random guy that I found in the I think he was in the Hangzhou train station, and I had my friend take a photo of me, and I just kind of wandered up to him, and he had this weird look that he kind of looked out. This is before you had phones where you could check. You know, this was taken on a proper camera, then we got it developed, and I was like, oh, this turned out awesome. Like, so anyway, that was me in China. And when I was there that first time, I met these two students who were from the US, and it's a different time now because we've got the internet, and like at that point there was no Facebook. The internet had just started. Like at home we had the old Dodo dial-up, beep 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 beep, and you could get on, you know. And I used to love getting on like those chats, like MSN chat or something like that. Anyway, we had email. It was just starting. We didn't have social media. So you weren't exposed to lots of these different things. The only way you got exposed to them was by reading these books, right? And you were like, oh, what's Bob Floor saying? Oh, what's this book? You know, and so you were kind of, it was hard to get these kinds of information on different styles of how people were practicing and how people and different schools and things like that. And so anyway, I met these students they were studying in the hospital just before me. Like they were finishing their part, they probably had a month to go, and I was just starting my start of the 3 months there. So I was kind of like, I was very young. I would have been 21 or 20, probably 21, I think. And like I had never travelled. I'd been to Vietnam when I was 13, as you know, into poverty areas, but not anywhere else in the world. And this was my first trip by myself, and I was just enjoying cycling around China and learning things. But I didn't know any Chinese. I didn't know where to get food, what was safe. Like there was so many, like not as in there was unsafe people or anything, but there was a lot of unsafe foods, like street vendors and street foods. Like, would this make me sick? What even is this food? You know, forget the Wuhan wet market. Like this was like, I've seen those wet markets, right? Not in Wuhan. I've never been to Wuhan. But these are kind of, what I'm saying is it was just crazy. So I was following these people around like you wouldn't believe, because I had no way of knowing what was what. So we would have dinner and lunch together and all that sort of stuff. You know, like I was just hanging off them like a fly. Because I was like, didn't know anyone and didn't know how to get around China. Anyway, so we got talking about different styles, and they said, we do a style of Chinese medicine that checks the pulse for an hour. I was like, what? That's crazy. I'd just never been exposed to this. They were students of Leon Hammer and Dr. Shen's kind of lineage, and very, very knowledgeable students, very, have gone on to do amazing things in Chinese medicine. But at that time, I was like, what? Wow, like I'd never been exposed to that. And so I guess watching this video, you're probably exposed to a lot of different things, and that's why it can sometimes be confusing, because you're like, well, which one do I choose? Like, what's the right way? And there's not like one, the problem is there's not one right way. There's lots of great ways, and there's probably some not so great ways, but you need to stick on something and just stick with that. Right now, you can't follow me to go, I'm doing Marie style, because this is a very broad understanding, right? This is not a video designed to teach you the masters of the pulse. It's actually like more of a clickbait title, right? But if you've got this far, you're obviously interested in it. And I want to help you on your journey to learn Chinese medicine and say, you need to find a particular style that resonates with you And it might resonate with you because you've either had treatment from a person with that style, you thought this really works, or you start to learn about it, start to read about it, and you think this is really works for me, and this makes sense. I think that's part of it. You've got to get your sensor meter working, right? And you go and you learn this, and you're like, I can kind of, smell the BS from a mile away sometimes. Some people are like, oh, you're just trying to sell me a course and like your BS system. Some people say they can check, I can feel if the person's got this coronary artery disease from their pulse, and I can feel if they've got this, I've got that. Maybe they can, but it's not really Chinese medicine, right? And I've heard some people say, I can feel if a person's had abuse in their life. They are different systems, and maybe that person has trained in that system from a long time in doing that. Certainly that's not my experience in how we check the pulse. We kind of check the pulse, we feel a particular quality. My system is based on the classical texts of Shanghan Lun and Jingui. So those kind of pulse qualities relate back to conditions where there'd be herbal formulas to kind of treat those things. If you're an acupuncturist, your pulse qualities might relate more to channels as well as organs, and or areas, and that's what we're going to talk about in this little part of the video. What the hell does this Sun, Guan, and Shi mean? What do they relate to? Why should I bother with them? So in a very broad sense, you can think of it as the upper part of the body, the middle part of the body, and the lower part of the body, right? So the upper part of the body being sort of around the ribs and the diaphragm area upwards. The middle part of the body being what in Chinese medicine we call the middle jiao. So if you're familiar with TCM and you've heard of the spleen and stomach or the digestive system, and on the left side, it's generally linked to the liver. So you can think of like left is the liver. That's how I always remembered it. But in a broader sense, it's much more about wood, right? The wood element on the left side, and the right side is more the actual spleen and stomach, the actual earth, right? So you've got wood on the left and earth on the right. And then at the bottom, now this is the part that's kind of a bit of conjecture for lots of people, or just conundrums, or I don't say conundrums, but like maybe there's a lot of confusion or different ways of interpreting it. But it is the lower jiao. And so some systems of TCM just say that's the kidneys, right? Both sides are kidneys. Now, it can mean the physical kidney. So if you feel something in that Chi position that's unusual, again, how we know it's unusual, unless you've been trained in it and you've been feeling lots of pulses, but if you feel something that's unusual, maybe unusual for that person as well, it could be like a person's getting a UTI, like a urinary tract infection. And that's something to do with their actual urinary system that's part of the kidneys. But also that is related to kidneys in TCM, like traditional Chinese medicine, is like the life force, your jing, your essence, all that kind of stuff. The underlying core of your body. Now, it is natural for your pulse to kind of go down a little bit, as in it slants downwards. Like your wrist is kind of, it's really hard to say, your wrist is kind of slanting downwards a little bit. So it's more normal for that last position, that Chi position, to be like lower or deeper, let's say, than the other positions. That's normal. But for it to be like something you can't feel at all would be really like abnormal. Like that wouldn't be a healthy pulse, basically, if you can't feel anything there at all. So what are we feeling in the pulse? Are we feeling the rate of the pulse? Are you just counting the beats? No, it's not just that. That's one part of pulse diagnosis. Pulse diagnosis has 28 different qualities of the pulse I think that's the Ming Dynasty style of pulse. And so if you read these kind of books, like they'll say, here's the different qualities, the 28 qualities, and certainly Ted Kaptchuk's kind of got the 28 qualities in there. So part of those qualities is a speed quality. So you could have a moderate pulse, or a Huan Mai pulse is like considered just a normal speed, but it also could have a different quality to it too. But in a speed sense, it's like a normal pulse, right? Speed. You could have a slow pulse, you can have a rapid pulse, and you can have a swift pulse or a speedy pulse. And again, it's confusing because sometimes these characteristics are compounds, like 2 or 3 things together. Sometimes they're simple things, like so speed is a category, and it's either slow or fast, and that You could use a watch to measure it, like beats per minute, but typically most TCM or Chinese herbalists or acupuncturists won't measure the pulse with a watch. The older way of using it, because think in the Han Dynasty when they made this stuff up, they documented it. They didn't make it up at that time. They were using it before then. But like they didn't have watches. You're going to use a sundial to kind of time the pulse. So they used the practitioner's breath. And this actually also tells us that in order to check the pulse, a practitioner's got to be healthy themselves, because otherwise their breathing wouldn't be regular. But they also have to maintain that regularity. Like of if your breathing is regular, it's kind of like a mindfulness, right? So how do you get into that state of being able to check the pulse? Well, if you slowed your breathing down or you regulate your breathing, that also slows your mind. It kind of clears, I've got to pay my bills, I've got to do this, or what patient's coming in next, or, so you're just kind of focusing on your breathing, and that would maintain this kind of regular breath. So the rate part of the pulse, like whether a patient has a slow pulse, has got to do with the beats per breath of the practitioner. How many, not the beats per breath of the patient. Because if a patient had a rapid pulse and they had a breathing issue, their breathing might be very rapid and their pulse is rapid. So that's not really telling you much, because their beats per breath would be in sync with their breathing. So anyway, that's what that part is. And then you have qualities based on the shape of the vessel, right? So that's essentially what you're feeling. So the shape of the blood vessel. So let's say this is a blood vessel here. Is that blood vessel getting smaller? Is that blood vessel getting like bigger than it normally should be? And so that would be like a hollow pulse, or some texts call it a big pulse. Now, most of these qualities have, like the 28 qualities have Chinese names that you could, pinyin names that you could bring it back to. And then there's usually the translation, like what I'm saying, like hollow. So the names of the pulse can kind of change. So I said a hollow pulse is could be considered like a pulse this is a normal size. The vessels feels much bigger than normal, but then there's also like not much substance in there. That's considered a hollow pulse. But that pulse could also be called a scallion stalk pulse or a spring onion pulse. These are just translations of the same Chinese original name, which was written in Chinese. So that can sometimes be useful if you're getting confused and you're thinking, what do you mean thready or thin? Is that the same thing? And this is why it's confusing. So I understand that you might be confused, whoever's watching this. Hopefully not by my video. So you're thinking of the pulse in terms of the rate of the pulse would be, not considered completely minor, but that's not all you're feeling. You're not feeling the pulse to get their heart rate. You're feeling the pulse to feel the shape of the pulse, the quality of the pulse. Like, is it like a wiry shape, a slippery shape? They're very common terms that you might have heard. And what does that actually mean? Then that comes back to where you felt that position. So what's amazing, I think, even for Western medicine practitioners and doctors, is to think, actually your pulse can be different on each side, like very vastly different. And then within these three positions, like that, you can actually feel like such a different shape and such a different quality there. Like Western medicines used to feel the pulse a lot more than they did, right? Western medicine doctors used to feel that the pulse, because now we kind of rely in Western medicine on a lot more tests and machinery and things like that. But as an indicator of like quality of blood, I guess they would be able to know. I mean, ambulance people still do that. They feel the pulse and they can feel if it's like, if you've lost blood, your pulse is going to become thready, which is like the volume of blood that's there to fill up the vessels less. So the pulse becomes small or thin, right? The actual shape, the size of the vessel becomes thinner. But then when you press on it, there's like not much substance to it. It feels like almost a tiny bit of pressure could kind of press it away. And that could be considered a thready pulse. So a thready pulse is like a thin and a weak pulse, like there's not much strength to it. In the system of pulse diagnosis that I use for herbs, we use less of these compound terms and more of these like combinative simple terms, like a thin wiry pulse, or thin, wiry, weak. And another practitioner feeling that might just consider that thready. So yeah, this is where it can be a little bit confusing again. I guess what I'm saying is there's a lot of stuff to, it almost feels like with pulse diagnosis, it's something where on one hand, you've got these people desperately trying to keep it secret because they don't want it to get misused by the wrong people. They're trying to protect their livelihood, right? This is not just right now, but just in history and things like that. And there's a big part of Chinese medicine history where it was considered like reckless to teach people that weren't going to do the right thing with that knowledge, right? Or that might bring a bad name to your lineage, to your things. So let's say I'm the student and I am desperate to learn Chinese medicine, and I go to a teacher and I said, oh, could you teach me? I really want to learn. And that person kind of knows me and they think, oh no, Marie, you're a bit reckless. You're just going to be here today, gone tomorrow. And I don't want to teach you. And so they would kind of choose to teach people, or they'd be like, oh, you're not of good character, so we're not going to teach you. Or they might say, yeah, okay, we'll take you on as a student. And you might have to work for them for years and years before they teach you anything of value. Because they want to know, are you here for the long term? Are you just here for the, the glory days and you're going, come and go on? Are you going to just try to steal something that works, a one-size cure-all and then peddle that on the streets and, try to make a name for yourself? And in the meantime, you're going to destroy the reputation of this practitioner because they'll know you, oh, Marie's so-and-so student. And so that's a big part of the history of Chinese medicine in there. Now, the way it's taught now is within schools. I mean, I think schools maybe could do better if they did think about their reputation a bit more, right? And they thought, should we graduate this student? Because what's the reputation going to be like? But I mean, at the end of the day, if they pass those exams, they're out in the world. And you always have people that pass the exams that are better than others in terms of different aspects. Like some people might be really good at knowledge and some people might be just better at charismatic, telling patients that they're great. And they can attract a lot of people to them. But their substance isn't there as much as others. And then you've got students that are just kind of a bit reckless or not, not as reliable as other practitioners. But they still could graduate. They still could, be out in the world practicing. So this idea is kind of a bit lost in the system of the educational system because lots of people can pass exams, but that doesn't mean they're necessarily a great practitioner. And if you were trained in a lineage system in the old days, right, before you had educational systems, your teacher wouldn't let you out in the world to be on your own until you're really ready. So some students might be with their teacher for a long, long time before they'd say, hey, you're ready to kind of go out by yourself, or you don't need to kind of be, you don't need my training anymore. You don't need to be here with me. Or they would pass on, they'd retire and pass the business on to the students. Anyway, so we're getting back to pulse. So you've got the positions, the Sun, Guan, and the Chu, and these kind of relate to these areas of the body. So the upper part of the body, the middle jowl, the middle part, and the lower part. And then you have these qualities that you feel. And so you're kind of relating those qualities to those areas. So it's very common to feel something different on the Sun, something different on the Guan, something different on the Chu. So like the Guan might be wiry, let's say. And the Chu, the last one, might be also wiry, but it's kind of deep and maybe faint. And that means something different to kind of the middle position being strong and wiry. So how you interpret this is very, very varied, like depending on your system of Chinese medicine. But in a general sense, you can kind of infer that, okay, there's some congestion going on in that middle jowl, right? If the middle jowl was wiry and much stronger, or which position did you feel when you put all your fingers on? This comes back to your making sure you're doing this right. You can't just put your fingers on and press these two down really hard and not press this one down very much, because of course you're going to feel a difference there. So you have to press all three fingers at the same time, the same level when you first do it. And then you might see practitioners just feel one at a time. So they always, well, not always, but they should feel kind of all three at once, firstly to kind of feel the overall feeling of the pulse. And then they might feel each position individually for different reasons. This video is probably going to be, it will have to probably be part of a series. I hope this has kind of answered some of your question. And I'm sure there's other people with a similar question, which is why I've kind of made this video for you. And so we might just leave it at that, and maybe the next time we can kind of talk about, you know, what these different positions, what the different qualities are. So what's a slippery quality, what's a wiry quality, those kinds of things, and we can kind of talk about that. So I hope this has been useful and helpful to you, and if it has, make sure you leave a like and comment on the video. That always helps other people to see that it's useful and valuable to them, and I'll see you again on the next video. So thank you.